Good afternoon. My name is Dr. Quita Weir Roberts. I am excited about our topic for tonight. We are continuing on with suicide as the month of September is Suicide Awareness Month, and I want us to continue the conversation on warning signs. So it's important that you know your warning signs. Somebody may be experiencing symptoms and signs of suicide. However, because you are not in tune to these warning signs, it may look like any type of struggle. It may look like depression. It may look like mental issues. It may look like a crisis. So, we want to be able to determine when somebody is exhibiting some warning signs. So, first and foremost, is there a family history of suicide? Has anybody successfully died by suicide in the family? Is there a financial loss within the family, especially if it has been recent within the caregiver of that family? Has there been an increase in behaviors, especially relating to painful loss, change of job, death, any of those things? Sometimes people may talk about their feelings. They may feel um, helpless, empty, hopeless, and they will tell you, I don't have nothing to live for. There's no reason to be here. Life doesn't really seem to matter anymore. Nothing makes sense anymore. This life is so difficult, it's so hard. There's no reason to live. They may start to give away their possessions. And I actually had a friend who did this. She was a medical doctor, and there was a case that went wrongly for her, and she became extremely depressed. And over a period of months, she started to distance herself from us. We, as the friends, knew there was something different. She always had a history of being by herself. So at this time, we didn't think much of it. So she was gone, and we just thought that, yeah, that's her behavior. She does this until she started giving away her belongings. She sold her car. She gave away some very important things to her. And even then, as friends, we were not keen on the fact that she wanted to end her life until actually it happened, unfortunately. So, talking about being trapped in their feelings, right? There is no solution to this matter. No matter what I do, nothing will change. It just seems like nothing is going to change. They feel unbearable, whether it is some physical or emotional pain. This is too heavy for me. Words like, I'm in a dark place. I can't manage to see my way out of this. Talking about being burdens to others. I don't want to be a burden to people. Maybe if I just disappear, um, you won't have this problem anymore. If I'm no longer here, then this will not be an issue any longer, right? So they withdraw from their family and friends. They stop attending events. So maybe if they were a social person, they completely stop showing up to events. If you call, they don't answer. This was something my friend did. She stopped coming to church. For weeks and months, she wasn't coming to church. And we started calling, and she will pick her phone calls. Initially, she would pick some of my phone calls, and then over a period of time, she stopped answering my phone calls. She would text me, and after a period of time, she stopped texting me. She started to withdraw and separate herself from us, little by little. And all of us, all of the friends, experienced that. One of the things that you will see, one of the signs that you need to watch out for, is when people start to put their things in order. They may say something like, if I'm no longer here, I want my son to have this, or, I want to be buried in this color. I want you guys to cremate me, or I don't want a funeral. I just want a memorial. Something they would say of that sort to put things in order. They may make a will, right? If this is a culture where writing of a will is something that you do, some people don't write a will, but they orally express their wishes, things that they like to do and things that they want. They may start to take risks. So sometimes we see people will go to a certain place, they will visit a bridge, and they will visit that bridge and they will have many thoughts of, what if I drop in the water? What if I jump over this bridge? What if I find my way down? So they start to initiate by visiting the site. Some people may be driving very risky, right? Any of those things that they can do, extreme driving where I could just slam my car into the street and die right now. What will happen? Some people would say that. They would talk about that. What happens if I slam my car into the tree and I die? What will happen? They talk and think about death quite often. It's like a preoccupation of death. They're constantly talking about death. These are some signs. Know your warning signs. And sometimes we dismiss it because we don't have the capacity to deal with it. And we push them off and say, oh, you're always talking about this death. You're not going to die. Stop talking about that. And they tell you that what happens if I die? Will you miss me if I'm no longer here? They may say something like, I bet you won't miss me. Life will go on. Everybody will go on with their lives. Maybe you may miss me for a little bit of time, but that's just about it, because they are trying to gauge, do you really feel or have the need for me to be here? Do I really matter to you, right? um, I want to highlight some serious warning signs that I need you all to pay attention to. If somebody may be at risk for attempting suicide, and this includes displaying extreme mood swings, suddenly changing from very sad to very happy. This is very typical of people who have already thought of a plan, they have already laid out their plan and they're acting on it. So in the beginning, they were sad because they were struggling with the thought of, I don't want to leave my loved one. I don't want to leave this person. I want to be here. And then all of a sudden, after they have figured out how they're going to execute this plan, they are not happy because they know, I have this way of doing it. Whether or not I have purchased a gun, whether I have visited this breach many times and I am at peace with the fact that I will jump over this breach, or whichever method that they have decided. But there are extreme mood swings that you must pay attention to. Making plans, looking for ways to kill themselves. So, such as, again, searching for lethal weapons. So, if this person have tried using pills, alcohol, any form of medication, um, and they weren't successful, now they are looking for more lethal ways. So purchasing a gun or getting their hands on some form of a weapon. Um, Talking about feeling great guilt or shame. And they will talk about it. I just feel so bad that if I ever kill myself, you know, I can't even imagine what that would be like. That's that guilt. They're struggling with feelings of guilt at that time, knowing that they are going through with this plan. So they have already thought it out. They have already planned it out. Now they're in the face of, how do I execute this plan? Using drugs and alcohol more often, acting anxious, irritated. They feel very short all of the time. They're angry, they're anxious. It's almost like they have a chip on their shoulder. So paying attention to that, right? The change in the eating habits. They're either eating too much or they're not eating at all. They don't care about eating any longer because in their mind, I'm almost out of here. I don't care about food. I don't need to put food in my body. I am on my way out. And sometimes they are showing rage or talking about seeking revenge on other people. So you have done something to me and I'm going to get even because, look, I want to close out everything before I leave. So, what are some action steps that we can take as family members, as friends, as co workers, students, teachers, providers? What are some steps? And I'm going to share 5 active steps with you. 5 ways that you can help someone who is in emotional pain. Number one, always ask, are you thinking about killing yourself? This is something that we struggle with. I don't want to ask somebody that I noticed they've been talking about death. We call that preoccupation. They have been preoccupied with death. That's all they talk about. This person is fascinated with death. And that's the only thing that they talk about. But I'm afraid to ask. Don't beat around the question, right? It's okay to be very upfront. Are you thinking about taking your life? Now, sometimes people will tell you no, they will lie to you. And there are other people that would say, yes, I have been thinking about it, right? It's not an easy question, but study shows that asking at risk questions, if they are suicidal, does not increase their risk of committing suicide, right? And it does not increase their suicidal thoughts. So get comfortable with asking those uncomfortable questions. How do you keep them safe? That's number two. Keep them safe. If somebody tells you, I have a plan, tomorrow I'm going to go to the St. John's River and I'm going to jump in the river and I'm going to kill myself, that's not the time to let them to be alone. Whatever you can do to keep them busy and to allow them not to be alone, that is exactly what you want to do. Reduce the access to any highly lethal items around them, whether it's a knife, it's a gun, it's an axe, cutlass, whatever. Make sure that they do not have any of those things around them. And that's very important in preventing suicide. It's not easy again to ask these at risk questions. I don't want you to hear me and say, well, Dr. Robert said that I should just ask, and once I ask, everything is okay. It's not going to make it go away by you asking those questions. However, asking if they have a plan and what are they planning to do. I see you have been talking about death a lot. Are you planning on taking your life? I need you to be completely honest with me. What can we do to help? How can I help? I want you here. We want you here. We do not want you to leave us. Now, I know what you are struggling with seems so heavy, and it probably is heavy. We want to acknowledge the fact that it's heavy for them. But how can we seek help for you? What can we do to help you? Let's talk about some ways that we can help you. Maybe it's financial issues that you don't see your way out. Let's talk about ways that we can help you in this situation. Maybe you are going through a divorce and all of the thoughts that are coming through your head is pretty much negative. I don't want to label out this person or how do I go on without this individual? Now my entire life has been changed. Number three, be present, be there. It's one thing to tell somebody, I am here, and not show up for them, right? We casually say that a lot. I am here if you need me. Action speaks louder than words. It's easy to send a message to somebody and say, you know where I am. If you need me, I'm here. No, get up and go to where they are. Let them know that you are concerned about their well being by being present, by being there, by listening carefully without judgment. This is not the time to tell them what's wrong with you. Are you crazy? Are you stupid? Why would you think about killing yourself? Are you mad or something? Oh, you are a Christian. You know, you shouldn't do such a thing. And do you know, as a Christian, if you take your life, you're going to hell? You are just passing judgment on them. And what if they're not in that mindset to care? You have just pushed them more in the mindset of, look, there to go again, passing judgment on me. Exactly what I said, exactly why I need to leave. So be very careful with your words. Acknowledging and talking about suicide may, in fact, reduce rather than increase suicidal thought. Number four, seek help. Many of us can do okay by talking to friends and giving advice here and there. But there is a difference between professional counseling, professional help from somebody like myself who has been trained over 7 to 10 years in this field to help somebody struggling than a mere advice. Now, advice to work sometimes, right? But when it comes to certain situations where it is above, like we say, your pay grade, seek professional help. Don't sit there and try to fix it because you feel that you can do it. It's easy, you can do it. If you know that it is too overbearing for you, it is too much for you, seek help. Once more, there are so many hotlines. 1-800 suicide. 988 is a free text message that you can text and you will get help if you are in the United States. If you are in Liberia, that's the Carter Center. There is also the Ministry of Health. There is also uh, E.S. Grant Hospital, which is the only psych hospital in Liberia. And you can always contact the friendly counselor, myself, and my organization. And whichever ways that we can help and provide support, we will be more than glad to help you in that area. Number five, stay connected. Even after somebody had successfully stopped, aborted their process of suicide, meaning that they completely uh, decided, I'm not going to do this anymore, right? I want to be here. I no longer want to take my life. Whatever it is not something that I cannot work through. I believe I will be fine with the amount of help I'm going to get. We need to stay connected. Staying in touch after a crisis and after somebody has been released from suicidal thoughts or hospitals or any of that stuff, there are studies that have shown that there have been a number of increase rate in people that remain, that stayed alive due to the fact that other follow and focus and were present for them. So again, if you or somebody else may be feeling like life is not worth living, there is no reason to be here. Nobody wants you here. You are in a dark place, and this may be due to a number of reasons. Please seek help. I want you to understand that taking your life is a temporary fix to the problem. Even after you are gone, there are people behind you that still have to deal with this issue. And there are so many ways to help yourself. If you will only speak to somebody, if it's a family member, if it's a friend, if you don't trust any of that, there are total strangers who are available, such as myself, a trained therapist, a trained psychologist, a trained psychiatrist who will be willing to walk you through this process. You do not have to suffer alone. Life does not have to end because you find yourself in a crisis. Please seek help. Contact the Friendly Counselor, myself, on Facebook, on Instagram, on Messenger. You can also call your nearest health department if you are in the United States. If you are in Liberia, once more, contact the E.S. Grant Hospital, the Department of Health, Ministry of Health, Mental Health Unit, the Carter Center, and there are many other free programs out there. There is help available for you. And as always, I want you to know that you are loved, you are wanted, and you matter. Until next time, join the Friendly Counselor group on Facebook, subscribe, like, share this live. It is very imperative that we share awareness for suicide, not just during the month of September, but we continue to do it throughout the year. Thank you, and I'll see you next time. Bye bye.